2010 marked a year of reflection and rebuilding from tragedy. On February 27, 2010, a massive earthquake hit the country of Chile. The 8.8 earthquake killed 452 people, damaged or destroyed 370,000 homes, and left 800,000 Chileans homeless. The 2010 Copiapó mining accident began as a cave-in on August 5, 2010, at the San Jose copper gold mine at the Atacama Desert near Copiapó, Chile. The accident left 33 men trapped 2,300 feet below ground, and they survived underground for a record 69 days.
Ayúdeme usted, compadre, pa' gritar un viva Chile, la tierra de los zorzales y de los rojos copihue, con su cordillera blanca. Pucha que es linda mi tierra, no hay otra que se le iguale, aunque la busquen con vela. No hay otra que se le iguale, aunque la busquen con vela. Chile, Chile mío, cómo te querré, que si por vos me pidieran, la vida te la daré. Chile, Chile lindo, lindo como un sol, aquí mismito te dejo, hecho un copihue en mi corazón. Mi tierra, no, compadre.
Así es, compadre, no hay nada que hacerle.
On September 11, 1973, Chilean society saw tremendous social and political upheaval. Socialist Salvador Allende's Unidad Popular government had been deemed unacceptable by United States Cold War interests. In fact, the CIA began the process of engineering his downfall even before Allende was elected president in 1970. After 3 years of economic sanctions, as Richard Nixon put it, to make the economy scream, media dissemination of anti-Allende propaganda, and direct agitation, U.S. officials had their wish granted. A coup d'etat led by General Augusto Pinochet quickly seized power, followed by a military junta. At the same time it criticized the military government in public, the U.S. government continued to subsidize the regime in secret. Henry Kissinger argued for the justice of subverting Chile's internal political process, saying, "I don't see why we need to stand by and watch a country go communist due to the irresponsibility of its own people. The issues are much too important for the Chilean voters to be left to decide for themselves." But, as might be expected, overthrowing a popular, democratically elected government met with political resistance. Pinochet's regime responded with a systematic campaign of torture, forced disappearances, death squads, and murder. Conservative estimates put the death toll during his first year in power at over 11,000 people. While defenders of free markets have argued that such violence was merely incidental to the economic reforms that would follow, critics of neoliberalism have argued that the unpopular changes required to liberate domestic markets could not have taken place without military force and state violence leading the way. A year of military rule gave way to a 16-year Pinochet presidency, the results of which have been described alternatively as Chile's economic miracle and one of the greatest failures of Chile's economic history. Economists at the University of Chicago, most notably Milton Friedman and Friedrich von Hayek, as well as a local vanguard of the so-called Chicago Boys, assisted Pinochet in applying what Friedman called an economic shock treatment. This shock treatment consisted of systematic deregulation, union busting, privatization, and social spending cuts, undergirded by Pinochet's continuing political repression. It is difficult to understate the economic failure of this great neoliberal experiment for the average Chilean. Immediately, real wages plummeted and unemployment skyrocketed. The number of persons in poverty increased from 20% in 1970 to 44.4% in 1987. Austerity measures made it so that workers and their families could not purchase goods, and the resulting contraction of demand led to more goods being produced for export, assisted by more free trade agreements than had previously been signed by any other country on earth. Due to these austerity measures and Friedman's policy of monetarism, inflation initially fell before exploding again to a rate 10 times higher than that under Allende. By the early 80s, the only thing that had prevented Chile from complete economic collapse was Pinochet's decision not to privatize the state-run copper industry. Eventually, copper would account for 85% of Chile's export revenues. Nevertheless, throughout this time of crisis, the economic elite, the top 10% or so of earners in Chile, would become massively wealthy. The situation unequivocally worsened in terms of non-economic factors as well. Between 1970 and 1991, rates of suicide and alcoholism tripled, working-class political action all but vanished, and Chilean society found itself increasingly atomized. Santiago became one of the most polluted cities in the world. Eventually, at the Pope's prompting, Pinochet would allow himself to be replaced by a democratic coalition government, known colloquially as Concertación, in a 1988 referendum. While the new government would increase social spending on health, education, and poverty relief, along with reversing a number of Pinochet's reforms, social democracy would never be fully reinstated, and much of the Concertación social welfare policies are currently under attack. Despite contemporary economic growth, remnants of the free market experiment can be seen to this day in Chile's highly inefficient private health sector, counterbalanced to a large extent, it must be said, by its excellent public health sector, high levels of unemployment and poverty, and extreme wealth gap. It is at this crossroads of neoliberalism and social welfare state that the Chilean family and healthcare system now stand.
Yo les voy a hablar sobre el doctor Iván Insunza, del cual el centro lleva el nombre. El doctor Iván Insunza es médico, titulado de la Universidad de Chile. Pertenecía a la clase media típica chilena. Él siempre estuvo muy comprometido con todo lo que era la salud pública, por lo tanto trabajó en lo que ahora llamamos el Fondo Nacional de Salud, el lugar donde él estaba trabajando en el año 1973, producto del golpe militar. El doctor Iván Insunza es detenido y hasta ahora es detenido desaparecido. No se ha ubicado sus restos y por lo tanto sigue estando dentro de la lista de desaparecidos en Chile. Él tuvo un gran compromiso social con la salud pública y es por esto que...
Currently, Chilean workers are required to pay 7% of their income toward health insurance. As part of the neoliberal health reform in 1981, insurance was partially privatized to allow more choices for consumers who were willing to pay for it. ISAPRES, an alternative to FONASA, was created at this time, opening up the market so that private insurance companies could compete for business. Consumers now have the option to take their 7% to a private insurance provider, and those who do often pay additional fees in order to receive better service and more comprehensive coverage.
The health insurance system in the United States is comprised of three primary components: government-sponsored Medicare, or insurance for the elderly and disabled, government-sponsored Medicaid, insurance for the low income, and private insurance, which can be purchased privately by individuals or through employers. Medicare was started in 1965, and it provides insurance to U.S. citizens who are over age 65, who are disabled, or who have end-stage renal failure or ALS. Medicare accounts for 12% of the federal budget and is partly funded through a 2.9% payroll tax that includes all wages and is split between employees and employers. Medicaid, which provides insurance for some low-income citizens, is administered on a state level and it is based on complex federal-state partnerships. There are three main groups that can be covered by Medicaid if they meet income eligibility: families with children, the elderly, and disabled. For each group, there are numerous statutory and regulatory pathways for establishing eligibility. Each pathway is defined by specific income and resource requirements that are determined by each state within federal guidelines. For example, all states must cover pregnant women with family incomes below 133% of the federal poverty line. Other eligibility pathways are available only in those states that choose to cover them. Private insurance can be purchased through a place of employment or as an individual. The private insurance market has a variety of payment and coverage models. In the private system, people can be denied coverage due to pre-existing conditions, and lifetime spending limits can be implemented in which a policy will not pay for any more services for a subscriber. Additionally, according to CDC estimates, 59.1 million Americans, or 19% of the population, were uninsured for at least part of the year in 2010.